And welcome back. Well, you're looking at the nation's smallest implantable cardiac monitoring device. It's 1/3 the size of a battery. Okay, there we go. Did I say that right?
A AAA battery.
AAA battery. There we go. And it might be small in size, but it's offering a huge relief to patients and doctors alike.
And so here to tell us more about it is Dr. Vikram Nangia from Aurora Health Care. Along with one of his patients, we have Joseph Hassman. Welcome, both of you, gentlemen. So nice to have you here.
Thank you for having us.
Incredible technology, and so I wonder, for people watching, how do you determine if this is appropriate for them?
So an implantable loop recorder, all that it does is record a patient's heart rhythm continuously. Patients who have episodes where they may lose consciousness for no apparent cause, and that's a very common problem. About 1 million patients in this country present to emergency rooms every year with loss of consciousness. If they have these episodes, and we know that abnormal heart rhythms is an important cause, such patients, if implanted with this device, we help identify the cause for the loss of consciousness. Very often, the abnormal rhythm is dangerous, so we can find the problem and fix it before anything bad happens to the patient.
Well, that's a huge benefit then, to be able to have that information. So one thing you kind of told us during the break is it's not the actual device itself that changes lives, it's the information that you're receiving from it about the patient and about their arrhythmia or issue that they may be having.
That's correct. Unfortunately, when patients lose consciousness, it's a very transient episode. Because that problem is gone, and so you have a hard time finding the cause. With conventional testing, only about 10 to 15% of times can you really find what the cause is. And we spend about $2 billion a year with those conventional tests. But with the implantation of this device, the diagnostic yield increases significantly.
I'm going to hold this up so we can see on our camera, because this is different than even a pacemaker. Correct. So this was newer technology. There was a fairly small implantable device, right?
You're correct.
Okay, looks like a flash drive.
Thank you. So it looks like a flash drive, and it's a little bit heavier. Here is the new one.
That's correct.
That's incredible. I mean, it's so much smaller. This one is so much lighter.
And not only that, it's able to do more than the old device was able to do. It can stay in the body for up to 3 years, and these episodes are often not very frequent. So by being able to maintain it in the body for 3 years, you increase the likelihood that you will find the cause. Also, this new device is capable of being monitored remotely, which is a huge advantage.
That's great.
From a doctor's smartphone even?
Correct. So if a patient has an abnormal heart rhythm that this device detects, it is transmitted through a patient monitor.
Which is set up
this is in a patient's home. This is uses cellular technology. The information from that device goes through this monitor to the physician through a secure internet connection.
Now, is that only if the patient is at home?
So the patient needs to have this with them.
Oh, okay.
If an episode occurs when they're away from home, when they get home, as soon as this detects the device, it'll send that information.
So
typically every night.
Right.
Yes.
I carry a little device here which I can put up to my monitor or the implant, and that also sends it to the doctor, and he can, so if I have an episode wherever, I mean, I just put that up here for a couple seconds, and then that sends the information.
Well, and Joseph, for you, how did you come to the point of getting this? What were you experiencing?
About 14 years ago, I had a situation where I passed out and I actually was, I guess, clinically dead for a couple seconds until I was brought back, and then more recently I was I passed out again and broke a few ribs and this and that and lost consciousness. So and I was brought in because we were trying to figure out why that happened. So in the course of doing some other tests, Doc figured out that it was best to have that implant to try that, because I have tried the Holter monitors before, where you have the wires and everything hooked up, and it's very cumbersome and hard to deal with on a day-to-day basis. But having this device is really great, because I know he's kind of watching all the time. So that's really, that's the amazing part about it, is that I know he's kind of keeping an eye on me no matter what, and I don't have to even do anything. So it's great that way.
Does it give you peace of mind?
Oh
too?
yeah, it's great. I mean, I feel so much better just knowing, because I do lead an active life, and it just having that inside of me, not having to worry about anything else, is great.
And it's not uncomfortable, because I know it's implanted right under the skin.
Yeah, it's right under the skin. You can't really notice it. I mean, there's maybe a little bit of a lump, but it won't be noticeable to anybody else, really.
You could wear your bathing suit.
Oh, sure.
You'd be okay.
Sure. Yeah, no problem there. Yeah. But yeah, it's great. I just the peace of mind is really, great for me, and hopefully it'll help out with actually learning something about my condition and maybe help others too. So
And the whole implant procedure is very straightforward. It takes less than 5 minutes to implant.
No way.
It is very easy. You make a tiny little incision, less than a centimeter, after a little local anesthetic, and you literally inject this device just under the skin.
Wow.
And so less than 5 minutes.
And you can leave it for how long, Joseph?
So the battery typically lasts about 3 years. Once the battery runs out, you could potentially just leave it there because it's so small and it doesn't really cause a problem. If someone doesn't like it, you can take it out. It's not a big deal to take out.
It's amazing.
The information that it gives, and just the peace of mind, as you mentioned too, is just wonderful. Want to make sure everybody knows how to reach you. So if they've got episodes or know somebody who may want to talk to you about your cardiovascular services, you can contact Dr. Vikram Nangia. Here's the phone number. It's 414-649-3390 at Aurora Health Care. Thanks so much for sharing your story.
Thank you.
And really neat device.
Thank you.
Great
Thanks a lot.
technology.
Yep.